After a 60-day assessment of our state's Department of Behavioral Health Care, Developmental Disabilities and Hospitals, I delivered a report to the governor on my findings and recommendations related to Eleanor Slater Hospital. Additional reports on my findings and recommendations regarding BHDDH's other divisions, which is Behavioral Health Care and Developmental Disabilities, will be produced in segments over the coming weeks, as the governor just shared. As part of my review of Eleanor Slater Hospital, I looked at departmental policy, operations, staffing, and quality standards of care, and also assessed departmental plans that were developed during the prior administration. I want to be clear, very, very clear, that many of these recommendations are not related to nor influenced by patient billing, because the issues and needs at Eleanor Slater Hospital go far beyond billing concerns. As the Secretary of EOHHS, our agency is the single state authority for administering the Rhode Island's Medicaid program, and I take that role very seriously. Given what has transpired at Eleanor Slater Hospital regarding Medicaid billing, my team and I are obligated to explore any concerns that are brought to our attention, no matter what they are or what they're involving or if we've looked at them in the past. While my team has done an incredible amount of work over the past 2 years on this issue, from drafting and submitting a new state plan amendment, often called a SPA, that was approved by CMS, to engaging an independent third party to review the hospital's IMD status retrospectively and prospectively, this was not the driver of my assessment of Eleanor Slater Hospital. I believe that the state should be able to get reimbursed for those services allowed by the SPA and CMS rule when appropriate. But if it's determined that the hospital does not qualify for federal reimbursement, or the hospital federal reimbursement amount shrinks, I stand ready with the governor and Director Charest to advocate for other ways to support hospital operations. During my time assessing Eleanor Slater Hospital, my focus has been on the issues raised by patients, their families, and staff about patient care, whether policies and procedures related to the hospital, contract management, and finances are being followed, the state of disrepair found at many of the hospital facilities, concerns I heard from those who have grown to mistrust the hospital leadership, and the need for a stronger continuum of care, from home and community-based services to hospital levels of care, for Rhode Islanders who need mental health services and medical care. I also want to share that during the last 60 days, it has been a struggle each and every day to get to the bottom of the concerns raised about the hospital and its operations. I faced resistance and a lack of cooperation and transparency from some of the members of the hospital leadership team. I am thankful to those leaders and staff who were forthcoming with information, and for the numerous stakeholders I met during this process, both inside and outside of the hospital, for providing me with a clearer picture of changes needed at Eleanor Slater. This report contains about 35 findings. However, today, or at this time, I would like to just share some high-level findings which most of you will not be surprised by. The previous plans for the future of Eleanor Slater Hospital need to be reconsidered. There is a need for a hospital designated as an LTAC. An LTAC stands for Long-Term Acute Care Hospital. There is a need for that designation. The physical infrastructure concerns are significant and need to be resolved. Licensure types need to be assessed and determined for the hospital based upon our state's future continuum of care needs. Policies and operational plans need to be reevaluated. The hospital is still working off of paper records. It has no electronic health record system. Change management, communication, and transparency are areas of growth. Budgetary decision-making, contract management, and oversight needs to be re-evaluated. The relationship between staff, labor, and leadership needs to be rebuilt so that trust and confidence can be restored. Reports of threatening behavior, bullying, and retaliation must be reviewed. There is also an entrenched and insular culture at BHDDH, and concerns about a culture of safety needs to be addressed. In total, I've made about 70 short-term and intermediate recommendations for the governor's review, and I want to take some time now to highlight a few of those recommendations from the following categories: leadership and staffing, operational, facilities, licensure, and community engagement. So first, leadership and staffing. My recommendations include, but are not limited to, reevaluating the structure of the hospital's leadership team based upon a logic model that is patient-centric. Realigning the leadership team to allow for true organizational culture change. And this is because the current leadership has lost the trust and confidence of staff, community, stakeholders, and the General Assembly. The team lacks cohesion and professionalism amongst one another, and their communication has not been consistently transparent or forthcoming with one another, let alone all of us. Reassessing the current titles and job classes and salaries of the leadership team to align with the scale and scope of work. There needs to be leadership training, coaching, and annual 360 evaluations. Another recommendation is restoring a culture of safety by creating a survey with a validated survey tool, and securing an incident reporting system that will allow staff to report complaints anonymously within a system that can't be accessed nor controlled by leadership. Asking human resources to investigate various concerns and recommend appropriate actions. And in terms of staffing, all of Eleanor Slater's staff deserve adequate training, a sense of support from their leaders, and to work in an environment that is safe, non-threatening, and where their ideas and concerns are listened to and acted upon in a positive way. Second, operational. My recommendation includes, but it's not limited to, establishing a clear financial and operational process that aligns with decision-making, reviewing all policies and revising as needed, creating a multidisciplinary team at the hospital for admissions and discharges, engaging court leadership regarding court-ordered civil psych admissions, engaging court leadership regarding the possibility for outpatient referrals for forensic patients charged with misdemeanors, streamlining and improving operation effectiveness between BHDDH and Medicaid, and resolving the current billing concerns. As it relates to facilities, my recommendations include, but are not limited to, streamlining and improving operational effectiveness between BHDDH and the Division of Capital Asset Management, also known as DCAM, establishing a meeting cadence with a project steering committee that regularly meets to resolve immediate health and safety physical infrastructure needs and the ongoing physical and safety needs for the infrastructure at the hospital. Requesting that DCAM provide a detailed building plan with cost projections for the possible new structure on the Burrillville campus. That DCAM also provides a fiscal analysis of the capital needs to repurpose the current Zambrano facilities, and a fiscal analysis of the capital needs of both Eleanor Slater campuses, and engaging DO-IT in a process to determine the electronic records needs depending on the level of care and cost for the Cranston and Burrillville campus. Licensure. My recommendations include, but it's not limited to, reevaluating the licensing framework for Eleanor Slater to accommodate for a continuum of care that is inclusive of all patient needs and level of care. engaging a consultant with extensive knowledge in patient care and licensure to evaluate the appropriate license types for both campuses, and to evaluate the correct licensure types for an additional building that possibly could be built on the Berryville campus. Licensing the Benton facility as a psychiatric forensic hospital separate from Eleanor Slater Hospital, and developing a business plan to ensure sound financial modeling. And last but certainly not least in recommendations is community engagement and transparency. This is big. The key element for success for Eleanor Slater as it moves forward is to engage authentically with staff, community, and stakeholders throughout each process and propose changes. Through surveys, listening sessions, email updates, newsletters, focus groups, and other means of communication, all of those who work with and engage Eleanor Slater Hospital deserve a seat at the table, and they deserve to have their voices heard and respected. Eleanor Slater Hospital has numerous complex, intertwined issues that will require our collective efforts to rectify. I greatly appreciate the governor's commitment to working together with Director Charest and I to address long-standing issues at Eleanor Slater Hospital and in building a better system for patients who rely on the hospital services.